A major shift in the U.S. government's public health messaging has stirred controversy this week after the White House repurposed the official COVID-19 website, COVID.gov. Instead of offering public health resources, the site now features a single topic: the claim that COVID-19 originated from a laboratory leak in Wuhan, China. Titled Lab Leak: The True Origins of COVID-19, the new homepage puts forward what officials are calling a truth campaign to reveal what they say was long-hidden information about the virus's beginnings. The newly launched landing page presents a detailed argument that points toward the Wuhan Institute of Virology as the most likely source of the virus. It references reports of researchers falling ill before the first known outbreak and argues that the virus contains genetic signatures suggesting it was artificially manipulated. These claims, long considered fringe by many in the scientific community, are now being elevated to the forefront of federal communication. What's especially alarming to many observers is what has been removed. Prior to the update, COVID.gov served as a central hub for vital public health services, providing vaccine information, testing site locations, and guidance on managing symptoms. With the shift, those resources have been taken offline or buried, drawing sharp criticism from medical professionals, public health leaders, and bipartisan lawmakers. Officials within the Trump administration have defended the decision as an act of transparency, accusing previous leaders, including Dr. Anthony Fauci and President Biden, of covering up the truth for political convenience. The site claims that early evidence supporting a lab origin was intentionally ignored and that efforts to question the natural origin narrative were labeled as conspiracy theories in an attempt to silence dissent. The scientific community, however, remains deeply divided. While some agencies, including the FBI and Department of Energy, have expressed limited confidence in the lab leak hypothesis, most virologists and epidemiologists continue to support the natural origin theory. Peer-reviewed studies point to animal-to-human transmission, similar to past zoonotic outbreaks, as the most plausible explanation. Yet the updated COVID.gov makes little to no mention of this scientific consensus. Many see the change as politically motivated, part of a broader campaign by the administration to revise federal messaging across key platforms. Similar edits have reportedly occurred on other government websites in recent months, with content relating to climate change, equity initiatives, and reproductive health being quietly removed or altered. Critics worry that the White House is using federal websites as tools for shaping public opinion rather than providing factual information. Beyond political ramifications, there are practical concerns. Health officials warn that millions of Americans, especially those managing long COVID or living in vulnerable communities, depend on centralized resources like COVID.gov. Removing these services, they argue, will sow confusion, harm public trust, and delay access to life-saving care. While some advocates believe it's valid to examine all credible theories regarding COVID-19's origins, they argue that the appropriate venue is peer-reviewed research, not public health portals. Turning a government site into what some have called a political statement is, in their view, a misuse of taxpayer-funded infrastructure. As COVID-19 continues to affect daily life and policy around the world, the decision to rebrand COVID.gov is likely to remain under intense scrutiny. Whether it results in a new wave of public distrust or galvanizes further investigation into the virus's origins, one thing is certain: the conversation around COVID-19 is far from over.